Hello friends, welcome to PSC Insight. ഇന്ന് നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത് കേരള PSC 2020 നടത്തിയ കാത്ത് ലാബ് ടെക്നീഷ്യൻ ഇൻ മെഡിക്കൽ എഡ്യൂക്കേഷൻ ഡിപ്പാർട്ട്മെൻറ്റ് എന്ന ചോദ്യപേപ്പറും അതിൻ്റെ പ്രൊവിഷണൽ ആൻസർ കീയുമാണ്. ക്വസ്റ്റ്യൻ കോഡ് 057/2020. ചോദ്യങ്ങളിലേക്ക് പോവാം. ഒന്നാമത്തെ ചോദ്യം, who published the first human electrocardiogram? Answer option B, Augustus D. Waller. 2. Exercise ECG is a valuable procedure for the assessment of ischemic heart disease. 3. In an ECG paper, each large square equals dash in height. Answer option C ആണ് 0.5 MV. 4. What is a normal value of ST segment in an ECG? Option C 0.05 to 0.15 second. 5. How to calculate the target heart rate of a female patient to stop the treadmill test? Answer option A 210H. 6. Which one of the following tests is used to detect arrhythmias, ischemia, or coronary artery spasm? Answer option B, Holter monitoring. 7. Lead V6 is placed over dash intercostal space in the left mid-axillary line. Answer option A, 5. 8. In which year first human electrocardiogram is published? Option D 1887. 9. Which one of the following measures blood flowing through the arteries and shows the pattern of flow through the heart? Answer option D Doppler echocardiogram. 10. For hypertrophy condition, which of the following is selected for standardization? Answer option B 5 mm. 11. Dash is used for scanning and imaging purpose of the body. Option C ultrasound. 12. The process of recording electrical activity of the heart over a period of time using electrode is called. Option C electrocardiography. 13. In a normal ECG waveform, the amplitude of R wave is. Option B 1.60 MV. 14. In echocardiography, position of the transducer over the apex in the fifth intercostal space is called. Option A apical location. 15. The loss of rhythmical activity of the heart is called. Option C arrhythmias. 16. Which of the following is known as ambulatory ECG recording? Option C Holter monitoring. 17. Lead AVF records the actual potential in. Option D left foot. 18. Which type of transducer is used in echocardiography? Option B piezoelectric transducer. 19. T wave in normal ECG is due to. Option B repolarization of ventricles. 20. The range of ultrasound frequency used for echocardiography is. Option D 127 MHz. 21. In an electrocardiograph, flow of current perpendicular to lead shows dash deflection. Option B biphasic. 22. In echocardiography, which type of signals are used in pediatric cases? Option C high frequency ultrasonic signals. 23. The standard speed for recording ECG is dash mm per second. Answer option B 25 mm per second. 25. 24. Based on universal color code, yellow color is used for dash lead position. Answer option D, left arm. 25. What will do when the graph paper showing excessive ST depression in exercise test? Option D, stop the test. 26. When the amplitude of the ECG is too low, dash is to be adjusted. Option B, gain control. 27. Which test is used to assess the size of cardiac chambers, ventricular functions, valvular functions and nature of pericardium? Option D, echocardiography. 28. The theoretical straight line joining the two electrodes is called? Option C, lead axis. 29. In echocardiography, which technique gives detailed information about atherosclerosis of heart blood vessel? Option B, intravascular ultrasound. 30. Holter monitor was developed in which year? Option D, 1949. 31. It is said that yearly 3 to 4 patients are rejected for cardiac catheterization due to overweight in USA. What is the limit for maximum patient weight for the X-ray table on which the patient is positioned in cath lab? Option B, 250 kg. 32. What is the loading dose of ticagrelor before coronary angioplasty in the patient with acute coronary syndrome? Option D, 180 mg. 33. Which of the following drug is not a coronary artery dilator? Option B, ergonovine. 34. Which test is performed before radial artery catheterization to assess patency of radial and ulnar arteries? Options: Allen test, Barbeau test, both, none. ശരി ഉത്തരം ഓപ്ഷൻ സി ആണ്, ബോത്ത്. 35. Balloon assisted tracking BAT is used during? Option A, transradial catheterization for negotiating loops, tortuositis and spasm. 36. Approximately how long manual compression be applied after sheath removal for attaining hemostasis? Option D, 5 minutes per sheath size in F. 37. Which size of JL catheter will you select for coronary angiogram in a patient with aortic regurgitation and dilated aorta of 50 mm? Options: 3 cm JL, 3.5 cm JL, 5 cm JL, none of these. ശരി ഉത്തരം ഓപ്ഷൻ ഡി ആണ്, none of these. 38. The number of holes in multi-purpose catheter? Option B, an end hole and 2 side holes. 39. Which among the following catheter you prefer to engage a high left coronary take off from ascending aorta? Option D, both B and C are suitable. 40. Normal TIMI frame count for LAD artery is? Option A, 36. 41. In approximately what percentage of the population you see left coronary dominance? Option A, 7%. 42. Which LV wall is not seen in a 30-degree RAO view during standard left ventriculography? Option C, septal. 43. Which angiographic projection is used to demonstrate shunt through ASD after injecting dye into pulmonary artery? Answer option A, LAO cranial. 44. What percentage of electrical energy provided to the tube is eventually converted to X-ray? Option A, 0.2 to 0.6%. 45. During angiographic studies, what percentage of the X-ray energy entering the body is absorbed? Option D, 90%. 46. Which of the following contrast is isoosmolar non-ionic dimer? Option B, iodixanol. 47. Total pulmonary resistance is calculated as option C, mean PA pressure divided by CO. 48. In a patient with aortic stenosis and resting cardiac output of 5 liters per minute with a LV aortic peak to peak pressure difference of 65 mmHg, quick aortic valve area by Hack formula in centimeter square is option A, 0.63. 49. How long flow state affect the estimation of severity of valve stenosis by Glorian's equation? Option B, overestimate severity. 50. In SVC saturation is, if SVC saturation is 70% and IVC saturation is 82%, the MbO2 will be option A, 73%. 51. What change in hemodynamic tracing is produced if there is an air bubble in LV pressure line? Option A, exaggerated systolic and diastolic overshoot. 52. In which condition you see LV pressure lower than aortic pressure? Option A, loose tubing connection, heterotopic transplant, extracardiac hemodynamic support. ശരി ഉത്തരം ഓപ്ഷൻ ഡി ആണ്, all of the above. 53. For every waveform, the LA pressure rise precedes that of PCWP by approximately option B, 100 to 150 m second. 54. The W or M pattern in RA pressure tracing is seen in option C, constructive pericarditis. 55. Broken Braunwald-Morrow phenomenon is seen during catheterization of a case of option C, HOCM. 56. Which of the following right heart catheterization data is consistent with diagnosis of primary pulmonary hypertension? ശരി ഉത്തരം ഓപ്ഷൻ ബി ആണ്. MPAP greater than 25 mmHg, PCWP less than 15 mmHg, PVR greater than 3 Wood unit. 57. Which leads represent the electrical activity of the inferior wall of the heart? Option A, 2, 3 AVF. 58. Pacemaker syndrome occurs in patient with option B, DDD pacemaker only. 59. Pacemaker mediated tachycardia PMT can be terminated with option A, application of a magnet over PG, retrograde VA conduction block, programming longer PVA RP. Answer is all of the above. 60. Normal HV interval is option A, 30 to 55 m second. 61. A regular narrow QRS tachycardia with a rate of 150 in a patient with a rheumatic heart disease is most likely option B, arterial flutter. 62. The initial current used for defibrillation using biphasic defibrillator for treating VF is option A, unsynchronized 200 joule. 63. During IABP, balloon inflation should occur at option D, dichrotic notch of aortic tracing. 64. Considering its effect on augmenting circulation, which among the following give complete support? Option B, ECMO. 65. Optical coherence tomography OCT is a catheter-based imaging system that uses dash for imaging. Option D, NIR light. 66. Differential cutting is a mechanism of plaque modification technique by option C, rotational atherectomy. 67. Watchman device is used for option C, LA appendage closure. 68. Which of the following wire is hydrophilic polymer coated wire. Options choice PT, Asahi Provator, run through. ശരി ഉത്തരം ഓപ്ഷൻ ഡി ആണ് all. 69. Which is the correct statement regarding left main intervention? Option A, provisional stencing is adequate in most cases rather than routine 2-stent strategy. 70. If the distal LM LCX angle is T-shaped with the significant disease of ostium of both LAD and LCX, the best stenting strategy among the following is. Option C, mini crush. 71. Chronic total occlusion CTO is defined as non-duration of coronary occlusion more than option B 3 months. 72. An operator is doing lat CTO angioplasty with ambulance guide in power position. The patient suddenly becomes restless with tachycardia, severe hypotension and tachypnea but no chest pain. ECG monitor doesn't show much ischemic changes. Echo doesn't show pericardial effusion. The anxious operator, after taking a check angio, find it difficult to arrive at a conclusion. You have to warn the operator for possible option C, acute aortic regurgitation. 73. The tip stiffness in G of cross IT 400 wire is option B 6 gram. 74. Which of the following wire is not a tapered tip wire? Option A, pilot 50. 75. Which among the following is the least traumatic hydrophilic wire? Option C, whisper. 76. Correct statement regarding the tonus catheter is option A, used during CTO angioplasty. 77. Which of the following catheter is used for re-entry after subinguinal passage while doing CTO angioplasty? Options crusade catheter, Stingray system, Venture catheter. ശരി ഉത്തരം ഓപ്ഷൻ ഡി ആണ്, ബോത്ത് ബി ആൻഡ് സി. 78. Corsair catheter is used during option A, CTO angioplasty using retrograde approach. 79. While doing a bifurcation angioplasty, the size of the main vessel stent must be preferably the size of option A, diameter of main vessel proximal to bifurcation. 80. For Medina 1.1.1 bifurcation lesion, if the size of the distal branches are 3 mm each, the minimum size of the proximal vessel needed for doing simultaneous kissing stenting SKS. Option C 4.2 mm. 81. Correct statement regarding perfect kissing balloon inflation is. Answer option D ആണ്, all the correct statement. All are correct statement. 82. What is the size of the balloon preferred for doing pulmonary valvuloplasty? Option C 1.2 to 1.5 times the size of the pulmonary annulus. 83. A minute of sign is essentially equivalent to dash minute of fluoroscopy. Option B 10 minutes. 84. Correct statement regarding radiogenic neoplasm is. Options: it is related to age at exposure. Females are more susceptible than males. ശരി ഉത്തരം ഓപ്ഷൻ സി ആണ്, both A and B are correct. 85. Regarding the retroperitoneal hematoma, which of the following are correct statement? Option C, deformed urinary bladder is fluoroscopy. 86. Hepatoclavicular view is option C 15 degree LAO 30 degree cranial. 87. The ideal projection for imaging main pulmonary artery branch origins is option C 15 degree LAO 30 degree cranial. 88. Significant step from RV to PA is diagnosed when O2 percentage of saturation rise is more than dash percentage. Option B greater than or equal to 5. 89. Normal arteriovenous oxygen difference in MI per liter is option C 30 to 50. 90. Equalization of diastolic pressures across all 4 cardiac chambers during hemodynamic study suggest option D constructive pericarditis. 91. During RF ablation of AVNRT, dual AV nodal physiology is suggested by option A AH jump more than 50 m/s for a decrease of 10 m/s S1 S2 interval. 92. Which of the following patient benefit from IABP? Option C acute MI with cardiogenic shock and VSR. 93. Select the correct statement from the following regarding use of rotablator. Option C never advance the bar in dianeglide mode. 94. Late stent thrombosis is defined as thrombosis of stent option B from 30 days to 1 year. 95. Cutoff value of normal angle branchial index is option A greater than 0.9. 96. The radiation exposure to cath lab technician is much less than that of the operator in a given case. The basis for the statement is option C inverse square law. 97. When blindly puncturing femoral artery under X-ray guidance, the landmark for needle entry into CFA is option A inferior medial quadrant of femoral head. 98. What is the maximum occupational radiation limit for an invasive cardiologist? Option B 5 rem per year. 99. Which angiographic view leads to greatest amount of radiation exposure to the operator? Option C eleo-cranial. 100. Resting coronary flow diminishes when the stenosis severity is option D greater than or equal to 90%. അപ്പോൾ നമ്മൾ 100 ചോദ്യങ്ങളും ഡിസ്കസ് ചെയ്ത് കഴിഞ്ഞു. നിങ്ങൾക്ക് ലഭിച്ച മാർക്കുമായിട്ട് ഒത്തുനോക്കുക, സ്കോർ വിലയിരുത്തുക. കൂടുതൽ ചോദ്യങ്ങൾക്ക് വേണ്ടിയിട്ട് ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക. താങ്ക്